Hey there, everybody. My name's Alexandru.
And I'm Dr. Shasta.
We're back with another episode of Your Healthy Living here in wonderful San Jose, Campbell, California.
Sunny San Jose.
Oh, yeah. It's a beautiful day today.
It's really nice. It's summertime finally.
Yes. Actually, solstice is coming up.
Yes, it
Yes.
is. Yeah.
We got to have a party.
I know.
Let's
that sounds
do it.
fun. Yes,
Okay.
definitely.
Let's get it done.
So I'm so excited. We have my friend and colleague, Dr. Tako, here today. Welcome.
Thank you for having me.
Thank you for coming. I know you're extremely busy, and to get you over here was quite amazing for us. You are a chiropractor, and you've been doing it a very long time, since 1998. And you're board certified as a certified sports practitioner. And you graduated in Israel, but you earned your doctorate at Palmer West College of Chiropractic in San Jose. And you also applied clinical nutrition and was the recipient of the 2013 Practitioner of the Year from Standard Process, which means
cool.
You are really, really good with functional nutrition, herbs, supplements, and helping feed people the nutrition that they need, which is really awesome. For chiropractors, it's like bone setting.
Right.
And for him to go out and learn some other modalities, such as the functional applied clinical nutrition and this other modality, PDTR, proprioceptive deep tendon reflex, which he'll be telling us about more.
It's a mouthful.
I personally experienced it. Is very powerful. And
Oh, you've done it.
I actually have.
Oh, cool.
And he's wonderful. He is able to treat ailments and physical ailments that other people have not been able to cure. And he's highly sought after and has a lot of people referring to him because of this. And he's really very extraordinary.
That's awesome.
Thank
He's
you.
a doctor of the future. So welcome. How are you?
Doing great.
Yeah.
It's a beautiful day out there.
Yeah, it's great. And, this is kind of interesting because I think a lot of people don't really understand the true value that chiropractors bring. I mean, I've believed in chiropractors for years and years, and it tends to be, kind of maybe the older generation sometimes that kind of, the AMA, doesn't approve of, but that's starting to change a little bit,
I
right?
think there is a major shift in that particularly.
And you're also
mainstream chiropractic is now very acceptable.
Yes.
You're an athlete also, and you help athletes.
Absolutely.
He is a
It's my passion.
what do you call that?
Archery.
You're an
Archery.
archerist. Oh,
I
really?
am.
Wow. I was just talking about that to a guy this morning.
Yeah, this is my Zen time.
That's cool.
Going to do my archery. It's my.
Didn't you get like second in the state or something like that?
I did.
Aha. See,
In my category.
I've got a good
In
memory.
California?
In California.
That's got to be a big category. There's a ton of people
Not
here.
really, because that particular style is so difficult that most people don't participate in that. So,
Oh. Huh.
but it's still very hard.
Yeah.
So you don't carry your bow in your car, do you?
No,
But you help a lot of athletes too.
I do. I work a lot
And
with athletes.
you work with moms who've developed pelvic pain from delivery, which is a very, very tough, you can tear ligaments, you can tear muscles, and
Well, it's got to be mess your back, too.
and your back. And I mean, this is a very, very complex and tough disorder to treat, and he does specialize in that also, and many other things. But we'll be back in a few minutes to hear more about Dr. Mir.
Yeah, this is going to be a great show. I'm kind of really interested in this whole, how do I say this?
Proprioceptive deep tendon reflex.
Okay, because we were kind of talking about that before the show, and I kind of thought it was more of a tapping thing, but it's not even close. I was totally wrong.
It's
So,
a lot more complex than that.
so stay tuned. We're going to talk more about this in just a second. You're watching Your Healthy Living.
At Way of Wellness, we help to rebalance the hormones of your body so that it can heal itself. Way of Wellness offers acupuncture, Chinese medicine, functional nutrition, Chi yoga, and wellness coaching. Call 408-615-1995 and start living the life that keeps us well.
Hey, everybody. Welcome back. My name's Alexandru.
And I'm Dr. Shasta.
And you're watching Your Healthy Living, and we have Dr. Mir.
Tako.
And we were kind of talking about your archery and stuff. And what were you doing before this whole chiropractic thing, and what kind of got you into it? I know you were going to school in Israel and so on and so forth, and ended up at Palmer.
Yes, long way.
Yeah, no kidding,
Yeah,
no kidding.
exactly.
Across the Atlantic. Prior to that, I was a biochemist. I was involved in research and just studying biochemistry. Over the years, I accumulated enough dysfunction in my body where my body was shutting off and shutting down. I couldn't really do much. Previously, I was an athlete. I was participating in running and high jump, just track and field.
Right.
In high level, really high level.
Really?
Yeah. And my body stopped working. And
Did you have an injury?
several injuries.
Okay. And then you just woke up.
shoulders, and I just kind of tried to recover with physical therapy and in the usual routine. Right. Eventually, a chiropractor put his hands on me. In fact, it was a recommendation. I went to a doctor before a surgery that was recommended, and the replacement doctor said to me, no, don't do surgery. There are other things to do before. And I said to him, like what? And he said, chiropractic. I'm like, seriously? Now, I heard about it a little bit, and from there, I went to a chiropractor, and lo and behold, my body started to function again.
Really?
And that changed
Wow.
my life completely and absolutely. So I said, hey, I'm pretty good with my hands. I'm excited about the philosophy of chiropractic. I'm excited about, helping people in a natural way.
Right.
And I took my bag and I flew to the U.S. and I went to chiropractic
Oh, so you
school.
actually left Israel to come here.
I left Israel
Wow.
to
To
become a
here to become a
chiropractor.
To
chiropractor.
follow
No
your
kidding.
dream.
Absolutely. And it wasn't easy because you have to, get a visa for that, student
Right.
visa, and you
Wow.
have to be accepted to Palmer. And I had to go and jump through hoops,
Uh-huh.
including learning English.
Right.
Oh, really?
That's a big
That
one.
was a
Wow.
challenge.
I mean, how can you go to class and
Can you
just
imagine?
learning English?
So
Is there a translator or something?
Actually, they help a lot in Palmer to
Really?
help that. Yes,
Hmm.
but I had to come here and go to college
Wow.
and take English and learning how to do all of this. And
Yeah.
I couldn't have a conversation like that when I
No
came.
kidding.
I could
bet.
read a biochemistry book or an article, but I couldn't have a conversation, like
No kidding.
day-to-day conversation. Yes, and I just learned English in Palmer really to converse about whatever it is that I'm doing.
Did it take you longer than normal to get the class done because of that? Or maybe
Not
they haven't helped you
really.
do
Did
it
you
faster?
say you made a couple of friends that helped you out?
Exactly. So
Ah,
He found
there
some
you go.
buddies.
I think one of
He
the
found some buddies.
yeah, I found some local guys that grew up here in the Bay Area,
Mm-hmm.
Dr. Dante Nettles and I forget that.
That's okay.
In any case, they really helped me
No
with
kidding.
my English and with my notes and everything else.
Yeah.
The school provided printed notes, so it was easier for me to do it. And since I had a really good education in Israel in science, it wasn't a challenge. I
Right.
was able to
And-
graduate.
And so you've come upon a new technique that is very, very unique, and you've been developing your practice is unique. Do you want to share why you've been studying that new technique and what it is and why you love it so much and what you use it for?
Yes, so that's a lot of questions.
I'm
and
sorry,
so I'm going to start with how I came across that. So I came across chiropractic because I got injured and my body was not functioning. That happened again. I accumulated a few more injuries, and finally, as I learned later, the body did respond that way. Even though I got adjusted, it wasn't enough.
Right.
And I had a shoulder injury that I couldn't really practice any longer chiropractic. And I came across that particular technique. The technique is developed by a spinal surgeon from Mexico, Dr. Jose Palomar Laver.
Mm-hmm.
And he was able to help my shoulder in 10 minutes on stage, demonstrating.
Really?
And when I realized that this, I couldn't believe my shoulder is moving again, and I'm able to practice again. I able to go back to my archery. So it was a big deal for me.
Yeah.
And I realized that there is something big here. And so I started to learn and study from Dr. Jose,
Right.
the technique.
Did you fly down to Mexico? To
No, he was actually coming here and teaching in the Bay Area.
learn? Nice.
And was a very small group in the beginning. I was one of his first students.
Oh, really? How
First
cool.
student to finish his program. Over the years, the technique evolved and developed more and more and more. There is more research being done, and today it's basically practiced all over the planet, in Australia, in London, in Russia. So it's really all over. He's flying all over to teach, and it's growing rapidly.
So I was going to say, so it's called deep tendon reflex, and I was trying to picture that in my mind. Can you explain a little bit about what that means?
Yes. So maybe I'll take you back first to the model that Dr. Palomar developed. He calls it the receptor theory, and basically every dysfunction in the body eventually comes back to a neurological signal that goes bad. Okay, just to simplify that. When we look at a dysfunction, we see receptors that are not working. Okay, so there is usually a primary receptor that is the injury or the insult to the nervous system, and we can talk more about what that can be, and a compensation that the brain created so the brain can live with that.
Okay, so the brain's smart enough to say, okay, you got this problem, so we're going to compensate by shifting the nerve. Is it nerves or?
Well, shifting signals. So typically what we see is the brain receives information from the body. That's basically 80% of what the body will do, what the brain does. And we call it affrontation. So the brain looks at all the signals, and from everywhere, from your mouth, from your eyes, from your skin, from your organs, from your foot, it doesn't matter, everything. And if everything is normal in that range of being normal, the brain will synthesize response that is a normal response everywhere in the body. Muscle tonicity will be normal, secretion of different hormones will be normal, everything going to be normal.
Right.
When there is an event, and an event could be an ankle sprain, it could be a toxic liver, it could be giving birth, it could be an athletic injury, it could be any of the above, concussion. Yeah. When that happens, many times the body heals, and we can see, okay, the ankle sprain is not hurting anymore, but the software, in a sense, didn't heal. That means that there are some receptors that are still firing into the brain. And so when now the brain looks at what's normal and he sees that coming from here and says, that's a threat, that's not normal. I'm going to create something else to balance things. Right? As the brain does that, there is a price to pay, in a sense. And eventually it leads to dysfunction in the body. It could hurt some organs, it can hurt some muscles, but the brain is doing the best the brain can do to
manage.
Like
a side effect or something.
Like as a side effect.
Right.
And many, many times when people go to the doctor is actually looking at compensation patterns.
Right.
And it could be blood pressure, it could be anything, headaches, it could be any of the things that we experience. Eventually, when that goes far enough, we see disease created.
Right.
There's this doctor in Santa Cruz who did a huge study on Parkinson's, and that most of 90% of the people she studied had a foot injury that never got properly healed. And it was an excruciating foot injury.
Oh, no.
And when they went to help heal the people with Parkinson's, they had to go back to the foot injury and heal the foot injury, and then the Parkinson's got reversed.
Absolutely.
It's a huge study. It's about
kidding.
a 500-page book that she wrote. I forget her name, but she's a doctor of acupuncture in Santa Cruz at Five Branches University. And she has great results with reversing Parkinson's by going back to that original foot injury. Isn't that fascinating?
That is fascinating, and it's exactly the model that I use to explain, because ankle sprain is kind of simple and very common. So I usually say you can have an ankle sprain and end up with constipation. People are looking at me, how?
Yeah.
Because that
connected.
abnormal signal goes to the brain, and one of the things that the brain decided to shut down or do something with is your gallbladder, and now you have suddenly constipation.
Wow.
And that's why things like yoga and Tai Chi and Qigong and even acupuncture help normalize things.
Get everything flowing
so
in the
that,
right direction.
So that all these
Absolutely.
the
That's
right
really
things
cool.
turn on. And then
I'm a little worried about. I broke my ankle in 6 places, so now I know what to say if I start getting Parkinson's.
but you work out a lot, so you've worked.
We'll be right back after this break. You're watching Your Healthy Living. Thank you.
I do traditional Chinese medicine, and that includes 5 different branches: acupuncture, massage, yoga, Tai Chi, Qigong, herbal medicine, and nutrition. It is amazing in helping the body heal itself that it releases the body's natural endorphins, serotonin, and seems to rebalance the hormones of the body.
Lower back pain was taken care of very quickly. 6 treatments and I was pain-free. And this was like 3 years ago and I've remained pain-free.
I've grown up in the Bay Area and I have had my own practice for over 15 years. When I was 12, I decided I want to be an acupuncturist, and by the time I was 25, I was licensed.
I have thyroid condition and stress, big time. When I walk out, I'm feeling like a whole different person. It's definitely a blessing to be able to come here.
I love helping women have babies, and the day that they actually get pregnant, the look in their eye is like, it's the best thing ever.
I've been struggling trying to get pregnant for the past 3 or 4 years. I came to Shasta. I would totally recommend her to anyone out there that is trying to get pregnant. She will do great for you.
Way of Wellness has to do with living a life that keeps us well.
Hi there, this is Alexander with It's All About the Show. You know, I've been with Money Concepts since 1994, and they have been the primary catalyst for my success as a financial advisor. If you're looking for a career change and you want to help people for a living, check out moneyconcepts.com/ALEE or call 946-8378 today. Hey there, everybody. Welcome back. My name's Alexander.
And I'm Dr. Shasta.
And we're back with Your Healthy Living, talking about, I can't even pronounce it, deep tendon reflex.
Proprioceptive deep tendon reflex.
Proprioceptive. Hey, I got it.
Hey.
I like that.
You got that.
Do you have to say that all the time? Did you have to learn it?
I just try not to talk too much about it.
Just call it PDTR, right?
Right. I usually talk about signals. It's easy. People understand
there you go.
it.
Yeah, and
Okay.
as a doctor of acupuncture, which is what I do, we work with the nerves all the time also, and signals to the brain and to the hormones and along these major pathways that have been mapped out for 5,000 years. And you were just talking about how at Palmer, there were...
Dr. Palmer.
Dr. Palmer taught about the foot having a bunch of reflexes to all over the body. Do you want to share a little bit more about that?
Yes, Dr. Palmer actually did the research and wrote a couple studies on that. It's called Neurogate 1 and Neurogate 2, where he described the exact relationship between ligaments in the foot and the rest of the body. Because as we're moving, it's all reflexive. As you're moving and you're putting weight on your foot and you're shifting the weight, you're actually stimulating different ligaments in the foot. And there are many of them.
Right.
Those ligaments, in return, that stimulus will inhibit some muscles and facilitate others. And that happens really, really quick.
Really
So we can actually move. And it not through the brain. This is just happening directly from the foot. So when you get an injury to the foot, it's extremely important to get a proper rehabilitation and taking care of it.
Right.
And even if it happens many years ago, it's still affecting your body. There's no way that it's not, because it's so profound what it's doing to the body.
I'm so glad you said that, because I had a similar situation just several weeks ago, and the doctor said, "Did you ever hurt your ankle?" I said, "Yeah, in 9th grade." We're talking 1976. He goes, "Did you hurt your ankle?" I broke it in 6 places. He goes, "Well, it never healed properly." And he had to do some kind of adjustment to it, and said that was part of other issues that I was having, not just, an ankle that pops when I jog.
Most likely a chiropractor.
Yeah, it was. It was a chiropractor.
There you go.
I know, that's
I love
totally-
chiropractic.
Yeah, chiropractors do recognize those things,
Yeah.
Right.
and
I'm a
will
huge
adjust your
fan.
foot and extremities and everything.
Yeah, if you don't believe in chiropractic, you at least got to give it a shot. I'm sorry.
Oh, absolutely.
You have to at least
Everybody.
check it out.
I mean, it was part of Chinese medicine. They were called bone setters.
Oh,
The
really? I didn't
acupuncturist
know
did
that.
bone setting. It's
Right.
been around forever. and
5,000 years of being able to test it on people compared to what, 100 years in medical science, maybe 100 plus?
Yeah.
Yeah. Well, I mean, we have to keep the blood flow unpinched, and our nerves unpinched for healthy living.
Right.
So that's what chiropractic does. What kind of people conditions benefit from your type of care? Who do you want to come to see you?
So I want people who really wants to get better and get healthy. Typically, my message to my patient is to be healthy and unmedicated. Because, if you're on medication, maybe you need to be on it, maybe you don't. But if you at least trying to be healthy and unmedicated, it's a good goal for us.
Right.
Otherwise,
Because the average, seniors on 10 prescription medications in America.
Yes.
So your aim is to help them be healthy naturally,
Right.
that they don't need the medications.
Exactly.
But you would never tell them to come off of it.
Right.
That's
No,
only
that's
what
an
their
ID's
Western
job.
medicine
That's
does.
not my job. It's not my scope of practice.
Yeah.
But my job is to optimize your health. And guess what happens when your health is optimized? Your doctor tells you, hey, you don't need this medication
Right.
anymore.
It's just nice.
Right? Which is kind of a nice side effect.
Yes.
But
Yes.
This one we like.
It's kind of a Band-Aid, I always said it's, painkillers are kind of all just like a Band-Aid over skin cancer. It doesn't do anything, but you can't see it, so it looks fine, right?
Right. And sometimes you need that Band-Aid.
Well, of course you
I'm
do,
not,
especially if they're in pain. Nobody wants to
exactly.
suffer,
When you're in
right?
severe
Right.
pain, maybe, but it's a good strategy for short term.
Right.
It's not a good strategy for long term.
Right.
Long
For
term, you better
wellness
get to
care.
the root cause of
That's
what's
right.
causing the pain.
Right.
And we need
So-
Western medicine. We have to
Absolutely.
have it
Western
anyway,
medicine.
obviously.
Hands down,
obviously.
we need Western
Yes.
medicine. They can keep you alive in
That's
critical
right.
stages, right?
Yes.
So we really like Western medicine when it's appropriate.
Yeah.
Otherwise, I would go to acupuncture. I would go to chiropractic. I would move my body. I would eat well. I would sleep well. I would try to meditate. These are the things that I would recommend.
The natural things.
Otherwise, the condition that we treat is basically anybody who has chronic pain or unexplained situation in the body, a chronic sport injuries that not resolving with physical therapy, car accidents that not resolving with care.
Right.
I don't care what's the care, but if it's not resolving, there is some things that we can do with, particularly with the analysis of PDTR, and really get to the root cause of what's going on, and maybe once and for all resolve the issue.
Yeah.
A big issue for people is surgery, post-surgery scars. I really like to talk about that because scar in the body, any scar anywhere in the body, will wreak havoc on the nervous system. And when that happens, it creates all kind of compensation patterns, and people are not aware of it.
That's true. That's what we're taught in Chinese medicine too.
So your job is to really create the environment inside of us to be able to deal with the source problem, as opposed to where on the outside they're like, okay, we fix the bone, we fix the pain, and
Exactly. It's to normalize the signals.
Right.
If we can normalize the signals, then the brain can manage the body better.
Better.
And
So, can you share a story about a case with us that you really are excited about?
there are so many.
I know.
that's awesome.
There's so many. So, and many times, maybe it's a category of issues. People come to a chiropractor because they have low back pain.
Right.
In this case, I'm talking about low back pains that usually are not resolved, even with chiropractic. And what we find is many times that the signal that creating the muscle hypertonicity or the problem in the back is really coming from digestion. So that's a category that we see a lot. If anybody goes to my website, there is a nice story from an athlete. He's a professional football player, Nick Johnson, that came to my office, and I can share his name because it's on the website.
Yeah.
And he couldn't run because of a hamstring hypertonicity, and he just couldn't run. He could perform everything else, but couldn't run. A receiver that doesn't run doesn't work
Yeah,
very
that
well.
doesn't work
Yeah,
very well.
yeah.
Yeah. So what we discovered after investigation, it took a while, but is that really the signal came from his intestines, and what we discover is that he's dairy sensitive. Simple as that.
Really, huh?
Yes, and
Oh
as soon
my
as he
Wow.
cut the dairy, that signal that irritated the intestine, that created a reflex that made the muscle hypertonic, just resolved.
Was it the iliopsoas that it made?
Actually,
hypertonic?
the hamstring. The
Okay.
hamstring usually is related to the large intestines.
Ah.
Yeah.
Really?
Yes.
So, I mean, because you can read the books like Wheat Belly and about gluten, that gluten causes a lot of pain and throughout the whole body. But I never really put it together with the dairy. I mean, we always encourage no dairy. We say that it causes inflammation. But I didn't really realize it could be connected to the hamstring like that.
Well, if you look at the embryology, remember embryology 101?
Yeah.
So we learned that, from an egg and a sperm, the whole thing developed. But in the meanwhile, there was this blastula of cells that created the brain and a little tail that created the spinal cord. And
Oh, cool! I just
Right.
learned something.
right, so the
Light
so
went on.
if you go to that subject, you're going to see that the differentiation of cells through the nervous system happens in a pattern of what we call myotome, dermatome, and sclerotome, and that stands for muscles. Dermis, which is skin, it's not just your skin here; it's also the internal organs.
Right.
And the third one is connective tissue and bones. And the fourth tissue is really nerve. So all of it develop along the nerve. And what we see is every organ in the body is related to very specific muscles and very specific skin area.
Huh.
And you can look at that neurologically, and you can see the relationship. And it's quite fascinating when you start to see the results, when you start to follow that map.
Really?
So I think this is just absolutely brilliant and wonderful. I'm a huge fan of your chiropractic care. What do you think the future of care looks like? And what do you want your listeners to know?
I think, the doctors should talk with patients about their nutrition, about their lifestyle, because that's a big issue, a big part of becoming healthy. Even in medicine, they start to do that, to talk with people about
starting
medicine.
to, yeah.
I truly believe that eventually the perspective of PDTR and the way Dr. Palomar is presenting that model, which is now spreading, I think that's a future for doctors to be able to analyze and understand what's really truly going on in the body,
right,
and find the right solutions for the problems.
Well, I think it's wonderful.
I was going to say, and again, your job really is to create the environment inside the body that makes it roll, that makes it perform like it needs to.
Right.
Well, how can people get a hold of you? What's your website? What's your phone number? So
the website is chiropracticway.com. And our office number is 408-733-2223.
That's an easy one, 733-2223.
Yeah,
I can see
we
that.
are in Sunnyvale, California.
I can see that commercial.
What is one thing our audience needs to know about?
That there is hope.
That there's hope.
I like that.
I like that.
There is hope, and all that money that you spent before may not have needed to be spent.
And trust nature. Go back to natural ways.
Thank you, Doctor. Appreciate you coming on.
Wonderful
Thank
to have
you so
you.
much.
Thank you for having me.
Don't forget to tune in to KIYSradio.com and see all our shows, Your Healthy Living, and some of the new shows we're putting up. The website's still a little under construction, but you can check us out on Facebook. Thanks for joining us on Your Healthy Living. Don't forget, like us, send us some stars or whatever you want to. My name's Alexandru.
I'm Dr. Shasta.
You've been watching Your Healthy Living. Have a great day.